Thanks a lot, everybody.
Thanks. Hi, Wendy. It's Diane. Thank you very much for that. That was really powerful, and to all of our speakers, that was really, really important. And you know, I like what you just said, that that you haven't had the chance to sort of reflect on how public health can be part of this. And I think, you know, public health practitioners sometimes don't have an opportunity to reflect how they can be part of it. So isn't it interesting about how, you know, having a conversation like this gives us all a chance to reflect on that, and through doing that helps us identify some opportunities. So that's a really nice way to end that. Now, there are a few questions that are coming in. I want to share one very quick story. When I was in public health practice, I was a public health nutritionist in Ontario for 15 years, and I worked a lot with teen moms and pregnant women in a variety of unhealthy situations. And one of my most memorable clients was a 16-year-old mom who lived in an SRO, or lived in that, I don't know if you would say an SRO, but was an SRO occupant. And, you know, I just remember that, you know, part of why I got to see her as part of the group was because they were concerned about her nutrition, but her, you know, her living circumstance was it was a single room that had no food storage, no refrigeration, no outlets, so couldn't plug in you know, even a mini fridge, no running water. It was a shared bathroom facility down the hall. So, you know, really our strategy and our group effort around her was to help improve her housing way before we talked to her about healthy eating. Because even though she was hooked into the food bank, and this is the part that sticks with me, even though she was hooked into the food bank, most of the foods that she got from the food bank come in cans, and she didn't own a can opener. And so, you know, there's something about the basics of life that people live in, and then the basic tools to even access the most basic of needs that really sticks with me about that. So that's, yeah, just something to sort of remember. So we will move into some discussion. We I want to note that the evaluation survey is here, the link to it, and I am going to start with the first question that came in, and then I'll pull up some of the other ones. So the first question was from Annabelle. How do you convince people of value working collectively? And I think that's open to any of our speakers. And so if our speakers can unmute, then I'll let you answer that.
It's Jane here. Can I start?
Yeah. Yes, yeah, absolutely.
I've been involved in health promotion and public health for a long time, and particularly in the practice end of the spectrum. And one of the things that I've learned is that you can't tell people something. You have to actually involve them in it so they can experience it. So one of the answers to that question is engage them in a collective experience. And from that, you can then move to promoting it more widely. But certainly, you have to walk your talk. People learn from experience more strongly than being told something. You can tell people, you can speak truth to power and tell them that this is the proper way to go about it, but you also have to give them an experience of it.
Anyone else?
Jeff?
Well, I would maybe just quickly offer that the question is hard for me to wrap my mind around, because maybe it's not about convincing, but it's just to amplify Jane's point. You know, in my experience, convincing is not about the sales pitch or whatever about how much better this is going to be if we can work collectively, but rather it's just kind of a natural extension of that idea that before any kind of grant is applied for, before any specific research question or any kind of idea of a program that needs developing begins, that there is already a recognition that you have some kind of presence, standing, or commitment to the long term in relation to that particular place that you are wanting to do your work. And I think Wendy spoke to that the best, just in terms of she's investing in the long term. It's not a 1-year program. It's a 30-year horizon in terms of the work that's going to be required to save the 4,500 remaining SRO units from their demise. And that problem is not something that appeared yesterday or even 10 years ago, but it's been a problem that's been with the city of Vancouver for 100 years. And so, the student, I suppose, or the new researcher, or even the established researcher, this is where the challenge is, where do you find the time to be able to invest, to be able to show that you are committed to that long-term relationship? It's very difficult, I think, to do in practice.
Really good point. We have a question here from, I think it said James Tijuana. As a student, how can we overcome the barriers associated with power dynamics? I feel as if we have valued voice in public health matters.
Yeah, I was going to say such a big question.
I know. Thought? How do students, and I mean, I think James is there with some Masters of Public Health students. So, what might be the role there?
Well, I could maybe respond to that. It's Wendy. Students, in my perspective, if they come to a project and just try not to take up a ton of space, or come to listen more to listen than to talk, and do things often there's a lot of labor in community organizing and in community projects, and a lot of it is tedious and not that glamorous. I think people appreciate it if students help out with a lot of that behind the scenes, not glamorous organizing, like I call it schlepping. We're always carrying stuff from place to place or setting up meetings. So I think you learn through osmosis. You don't have to directly engage with a project. So even if you're there just to do some assistance, that's a really great way to start building trust with people and lift some of the heavy load of community organizing that communities are often saddled with on their own.
Okay. So we have a question from Tricia. What's the feedback on the role of social entrepreneurship, co-ops, and business, and how business can help improve communities? What's that larger role they can play?
This is Jane. I think social entrepreneurship and co-ops have an important role, as we've seen with the Multicultural Health Brokers Cooperative and also the collaborative downtown in Vancouver. I think I always go back to principles. It's how people work. So if the involvement of social entrepreneurs and co-ops and certain businesses in collaboration with communities, then they have a role to play. But it's not telling them or pushing them in a direction they don't want to go, but it's actually collaborating and working with the communities driving it, and not them leading in for their agenda. And it's about compromise and other factors of complex interplay. I have seen examples of where those categories have come together to work with communities, not in Canada personally, in the UK where I used to work and live. In Manchester, there has been, in some parts of the city, some active interplay between those to address social determinants of health. And to just come back to something that Wendy said about why doesn't the public health system encourage advocacy, etc. I think there's a role for the public health sector, not necessarily to do that work, but to actually pull the strings and encourage intersectoral collaboration. And it has happened and it has worked in other parts of the world. There's no reason why we can't play that role and move beyond the boundaries of healthcare to work with others across the different sectors.
And we hear that often, right? That the solutions to health often lie beyond the health sector, and the importance of that intersectoral approach. And that public health sometimes is the coordinator of that approach because of the ability of public health to reach multiple different sectors.
Yeah, absolutely.
We had a question. We had a question from Bren. You had said, I think it was Jeff that had said the housing first model is not working. So is that a housing supply issue, or is it more that the approach overall is not effective?
So that was, yeah, Jeff, do you want to answer that?
Yeah, it was Wendy. Why don't you start, Wendy, and then I'll amplify.
It's kind of related.
You're the one that sees.
It's related to the question that was asked just before as well about how business can play a larger role to help improve communities and conditions. Housing first is, in my mind, I could be wrong, but housing first means you can use the private sector to place people in housing. So get people off the street and work with the private sector to house people. I'm believing, after my 30 years of experience of seeing housing issues in my community play out, that people are better off in purpose-built, supportive or social housing or public housing. I live in a co-op, and it's a community. We don't have to deal with the pressures of the market. And I also started a social enterprise years ago called the Public Cafe. And I think that using a business approach to solving social problems isn't necessarily, it's like the icing on the cake. It has a very small impact, but really what we need are the big universal programs for people. We need social housing, public housing. We don't need people to we don't want our governments to just focus on social enterprise or models that help us collaborate with the private sector. So if we have those bigger systemic fixes in place, then we won't need to invest our time in smaller impact approaches or impacts like social enterprise and the housing first model. But Jeff, maybe you can say something more clear than that.
No, that was fine, Wendy. I mean, I think all I would say is that there's been a bit of in my observation, there's been a bit of a mutation of what goes through people's minds when you say the words housing first. So as an intervention approach, I think the evidence is very clear that housing first, the idea that getting people into safe, healthy, supportive, stable housing is a necessary first step and an entree into being able to provide wraparound supports where necessary to ensure that housing stability can be sustained for the long term. That model, I think, is absolutely proven from an evidence point of view. The mutation is when there's kind of like a bit of a expansion of what we mean when we say housing first, and it's sort of become like the idea that housing, the need to be able to provide more housing is something called housing first, and so how people think about housing first exceeds that specific kind of intervention. And what housing first isn't, and I think the question, I can't remember the name of the person, I'm sorry, but the question is it a supply issue? And it very much is. I mean, the problem that we have in Canada and in Vancouver in the downtown east side is not a general supply issue, but a specific need for a return of massive investments in providing affordable welfare rate housing, matched with a willingness on the part of the public health sector and the broader intersectoral supports that get involved or that are necessary to provide supportive housing for people in whatever housing scenario exists in a specific context. And I know that Housing First works with what is available on the landscape in which it's being implemented, and that varies from city to city and province to province. But so I think that would be how I would situate that critique.
Thanks. We have one more question from Stephanie. She says, Wendy's so right that public health struggles with system advocacy. And it's true. We hear that a lot from our public health audience, but it's really hard to do any level of advocacy in their work. So any strategies that any of our presenters have found work? Any advocacy strategies on a system level? There was a comment from Irv Rootman. I'm not sure that it's made it to the box yet, the chat box, but he was saying, it's important to develop strong relationships with politicians, especially those that likely would be sympathetic, that might be part of addressing those political issues. What do people think in terms of advocacy strategies?
I'll just, I don't think I have a decent answer for this in the time we have left, but it's a difficult question to pose because part of which is because what do we mean by public health?
Exactly.
Right? I mean, I think the answer to that question really does depend where you are sitting in the universe of public health. And some parts of that universe are a lot more constrained, at least on a formal level. And other parts of that universe, I think, have a little bit more support, a little bit more more degrees of freedom to be advocates. And certainly in the context in which I work and I observe public health, people in public health roles, you can see the differences from place to place. And so, so that's not an answer, that's a preface to an answer. But I suppose in places, irrespective of how many ties that are binding you in a formal sense, you might try to think about, I mean, I think a lot of what I see in the places where there's more of an institutional constraint, you see an effort that's more behind the scenes advocacy and support. Some might call it a sort of Trojan horse approach, where you have to work within the context that you have, but you do the more participatory, the more social justice-based approach, sort of a little bit more subtly and behind the scenes.
It also takes time. You have to build those, it's relational. You build those relationships with people over a period of time. And it's not a quick fix. It's applying, as Leslie's put in the chat box, different approaches that encourage systems level change. And so you gradually build connections within the system with relationships with the people and actors in the system. I mean, a whole systems event I've seen happen here in Edmonton around early child development, and it's been very fruitful in making those, starting to shift things slightly in what is a very fragmented system, and we're doing it through the evaluation.
There are no more questions from the audience. There's one last quick one that I want to get in because I don't think I've heard it discussed specifically, but how does this concept of, participatory practices align with working with our Indigenous communities and engaging with our Indigenous communities in a really meaningful way? And how can public health build in participatory practice to do that very important work?
Well, I have to say I love that question, but I don't love the fact that it seems like we have 2 minutes left to answer it. I think that's unfortunate. To the person who posed it, I would encourage you to email me because I've had a lot to say about that issue quite a bit in the recent past, and I would certainly love to talk more about it, I guess, offline if necessary. The one thing that I would say is that there has not been nearly enough recognition within, and I'll speak specifically about health promotion here, in which the principles of participation are a part of the overall ethos of health promotion, that there has been not enough recognition that a lot of what we say and a lot of what we do is rooted in Indigenous epistemologies and Indigenous practices. And we need, in order to decolonize health promotion, we need to start doing that work of recognizing that which has been, in some ways, expropriated.
And I think, you know, the last webinar, through the previous one that we did in this series with Charlotte Lopi and Mariette Sutherland out of Sudbury, they talked a lot about relationship building with our Indigenous communities and the importance of that underlying any of the work that happens involving Indigenous communities and Indigenous peoples. And for some public health practitioners, that actually may be the starting point, is forming those relationships and building those relationships in order to evolve into something as something like an actual true participatory practice. A lot to consider. So at that, I see some people are typing in some last comments. I think we will need to end it here. Oh, I'm seeing Leslie has offered Health Promotion Canada is going to dive into that conversation around Indigenous perspectives, anti-colonialism, and the core competencies related to the work happening there. And you know, I know in Ontario, for example, there is a new directive from the Ministry of Health about relationship building with Indigenous communities. So I think there's lots of opportunity for us to learn from each other. So I want to thank everyone, and yes, we can share the NCCAH link resource. What I will do on that is any of the links that have been posted here at the chat box, I could certainly send to participants within a couple of weeks. Once we compile evaluation results, I can send that to people who are interested.